We'll talk about this one in class. Look on the lateral view on that one and look at the retrosternal clear space. You can kind of use this one maybe. You see how the retrosternal clear space is supposed to be nice and radiolucent, isn't it? Because I don't think there's any widening on this mediastinum, on the frontal. But when you look on the lateral, do you see there's a bit of density right here? There's some water density. This whole area here should kind of look like that or like that, shouldn't it? It should be purely radiolucent. And there is an area of water density in the anterior mediastinum, isn't it? Now how do we know that it's mediastinal? Because there's nothing here and there's nothing here. There's nothing in the lungs that would account for something superimposed. You know, there's nothing in anterior number 2 on either side, which is what all of this is. The retrosternal clear space is largely produced by superimposition of anterior segments number 2 on both sides. That's typically what produces the retrosternal clear space. So this has to be a mediastinal mass because there's nothing in the lungs that would account for that density. So it's got to be in the center. It just didn't go far enough laterally to change the configuration of the mediastinum. So it's not down on the bottom, so we wouldn't consider Morgagni hernia or pericardial cyst because they're down here. Thyroid's up here. You know, thyroid's up high. The ones that tend to be more in the middle are the thymus, pterygoid, because that's right at the top of the heart typically. And so we'd have to consider especially thymoma. Now, we said yesterday that thymoma has a bunch of different variations. It can be a thymic tumor, which is thymoma. Those can be benign or malignant. Thymoma is related to the cranial nerve paralytic disease, myasthenia gravis. Does Dr. Amos talk about myasthenia gravis? MG?
Yes.
Cranial nerves, a lot of times they have swallowing issues. They may have slurring of their speech episodically. They may sound like they're drunk when they talk, when they're not. And there's a relationship between having a thymoma and myasthenia gravis. We don't know why there is, but there is a relationship. And so if a patient is diagnosed with MG, they scan the chest and see if they have a thymoma. And if they do, they surgically remove the thymoma because it improves, it slows down the progression, it improves the myasthenia gravis. So there's a relationship, but it's not a 100% relationship. So this proved to be a thymoma. And that is one of the features of thymomas. They may enlarge more front to back and not much side to side. So they may not be visible on a frontal like this one.